So the more specific signs and symptoms associated with a measles infection would be something called Koplik spots. Koplik spots are small white lesions that occur in the mouth. They typically are going to be around inside of the cheeks and then also underneath the lip, as seen here. And they kind of are just going to resemble almost like very small ulcers with their white discoloration. So Koplik spots will typically be one of the first specific indicators that someone has measles. These spots typically pop up in the mouth about 2 days before the appearance of the standard rash that we associate with a measles infection. So we would kind of be on the lookout for these in the mouth, and then that would typically be followed 48 hours later by the traditional measles rash, which the rash that's one would experience with measles would be a red rash. Typically, the rash is going to start out on the face and neck because of the respiratory transmission, and then it continues to spread throughout the trunk and the extremities, like the arms and legs. But the red rash and the Koplik spots in the mouth are the more specific signs that we would associate with someone having measles. Now, these are not the only things that someone with measles would experience. Certainly, there are individuals that get measles and would just experience the rash and some of the nonspecific symptoms like a cough and sore throat. And those individuals are quite lucky. There are some very severe complications that are associated with measles, and one of the main reasons why we need to be really cautious in preventing measles by getting vaccinated is because of the extensive complications. And these complications are actually quite common, especially among children and the immunocompromised. So what are the complications? So there are 3 primary complications that are associated with a measles infection, the most common being pneumonia. Measles is transmitted through respiratory transmission, so it does initially start out in the lungs. In most individuals, it will jump from the lungs into the blood and then typically present as a rash. But in some individuals, especially those that are immunocompromised, it is able to cause a more severe infection in the lungs, leading to inflammation and the accumulation of fluid in the lungs, which is what we know as pneumonia. So one of the primary causes of death as a result of measles is from a fatal case of pneumonia. The measles virus is also a virus that is able to get into the nervous system. So the measles virus can get into the nervous system and lead to inflammation in the brain, which is a condition that we know as encephalitis. Inflammation in the brain or encephalitis is particularly dangerous because when the brain becomes inflamed, it could potentially no longer perform its functions, which are life-sustaining. This could ultimately, encephalitis could ultimately cause a patient to go into a coma, and then ultimately that could lead to death. And certainly the most severe out of all the measles complications is a condition known as SSPE. It is a mouthful, but the condition is subacute sclerosing panencephalitis, or SSPE. So this is a neurological degenerative disorder where the measles virus gets into the brain tissue and it infects and destroys brain cells. It destroys very important portions of the brain, such as the cerebral cortex, the white matter, and the brainstem. These particular areas are very important as they control things like muscular movements, which ultimately control things like breathing and the heart. So if these areas of the brain are being destroyed by the measles virus, obviously one would not be able to live without these regions. So unfortunately, this condition is 100% fatal. If measles progresses to the point where someone develops SSPE, there's nothing that can be done. Eventually, brain function will stop. The patient will go into a coma due to the degeneration, and ultimately it will lead to death. So, yes, in some individuals, measles is just a disease that produces a rash, but certainly not in all individuals. There is an increased chance of complications, especially amongst the young and immunocompromised. And these complications, as we just covered, can be quite severe and can ultimately lead to death. So it is really important that we prevent individuals from getting measles in the first place, which brings us to our next slide, where we're going to talk about some vaccinations. Unfortunately, with treatment for measles, there's nothing that can really be done. If you contract measles, really all they will do is monitor your signs and symptoms and provide supportive care. So they will do something like monitor the fever, make sure it doesn't get too high. If it does, they can give you something to bring it down. If you do develop a complication, such as pneumonia, they can obviously provide supplemental oxygen to help. But in most cases, it's just dealing with the signs and symptoms and not really fighting the infection. Typically, the infection has to run its course. Your immune system is the only thing that's going to be able to fight back, and you essentially hope that your immune system is stronger than the virus. But in some cases where it develops to complications such as SSPE, there's nothing that can be done, and it is 100% fatal. So since there's really no treatment for measles, everything gets put into preventing people from getting measles in the first place. So how to prevent someone from getting measles is by vaccinating them, specifically vaccination through the MMR vaccine. So this vaccine is a vaccine that protects us against measles, mumps, and rubella. We get several doses of this when we're children. So you get your first dose at 12 to 15 months, and then a second dose at 4 to 6 years of age. And then on average, that typically, that second dose gives you immunity of about 20 years. In some individuals, it can be much longer, but in some individuals, it could be shorter. So typically, by the time you get to your mid to late 20s, you would want to get your titers checked just to make sure that you still have immunity. And then if you don't, you obviously want to get boosted. But it is very important to stay up to date on your measles immunity, because unfortunately there is a modern movement to not get vaccinated with MMR vaccine, as well as other vaccines such as polio. There was a false study released several years ago that tried to link the MMR vaccine with autism. Basically, the author that wrote the study reported fraudulent facts, and again, he tried to say that the second dose of the MMR vaccine was causing children to become autistic. That study was eventually proven to be fraudulent. That author lost his license, but unfortunately, some individuals still back that movement, and it has created a larger portion of individuals who are refusing to get vaccines such as MMR. It wasn't that the MMR vaccine caused autism. It just so happened that the second dose of MMR and the signs and symptoms associated with the onset of autism typically happened around the same time, 4 to 6 years of age. It wasn't that one caused the other, they were just happening at the same time, but there was no causation. So because individuals have been refusing MMR vaccine, we have started to see sporadic cases of measles popping up in the United States. So it is very important for yourself that you make sure that you are up to date on your vaccines so that you don't potentially contract measles and pass it on to yourself or obviously to a loved one. Okay. So this second disease that we'll talk about is rubella. So rubella, we're going to just call it rubella in this class, but it has different names. Sometimes you'll hear it called 3-day measles, and other times you'll hear it called German measles, but we're just going to call it rubella. This is a viral disease caused by the rubella virus. It is a highly contagious disease. highly contagious because it is transmitted through respiratory droplets. So someone that has rubella, again, when they cough, sneeze, or speak, they will expel the virus in their mucus droplets for others to become infected with. Generally, in children and adults, rubella is a very mild infection with no complications and very minor signs and symptoms. So then why do we care? Why do we care about rubella? What's important about it? We care because it can be really, really dangerous if a pregnant woman contracts rubella. If someone that's pregnant contracts rubella, especially in the first trimester, it can be transmitted to the fetus. It can actually stop fetal development, which could ultimately lead to a miscarriage, or it, depending on what stage in development the fetus was in, it could lead the baby to be born with various different abnormalities. So the reason why rubella is a concern is because of its impact on pregnant individuals and the fetus. So there are different classifications of rubella. So in anyone that's already been born, so a child or an adult, if they contract rubella, we would call that postnatal rubella. It's different if a pregnant woman contracts rubella and then transmits it to the unborn baby. That is called prenatal or congenital rubella. But in children and adults, if they contract it, it's called postnatal rubella. And postnatal rubella is honestly very mild. Some individuals will even get it and not even know that they have it. They'll be completely asymptomatic. However, in the individuals that do contract it and do show signs and symptoms, really the only thing they experience is a flat pink rash. It's a rash such as the one pictured below. It typically, or in this picture, it typically does start out on the face and neck because of the respiratory transmission, and then eventually progresses throughout the rest of the body. But it's really just a flat pink rash. It's typically not accompanied by any type of fever or anything, so it is a really, really mild infection, and typically resolves itself within just a few days, often 3 days. So really that flat pink rash is the characteristic sign that we would associate with a rubella infection in a child or an adult, but very minor. So where rubella becomes quite concerning is when we talk about prenatal or congenital rubella. So this would be a case where a pregnant individual would contract rubella, and then the rubella virus would be transmitted to the fetus in utero. One of the most important things that's happening during embryonic development in that first trimester is we're producing cells that are going to make organs and tissues for the fetus. But when the fetus becomes infected with the rubella virus, it actually induces apoptosis, which is essentially the destruction of cells. So now you're doing the opposite of what you're supposed to be doing. Instead of making cells for tissue development and organ development, you're destroying the cells. And this could cause potentially a miscarriage on the extreme end to a variety of different abnormalities. It kind of depends what stage in embryonic development the fetus was in when it became infected with the rubella virus. So there's a variety of different complications that can happen, but the most common, and the reason why I have it bolded, is deafness. So deafness is the most common defect that can result from a fetus being infected with the rubella virus during embryonic development. There are other things that can happen, like cardiac abnormalities, ocular lesions on the skin, which could potentially lead to blindness, and then various different mental and physical defects. But deafness is certainly the most common.